as I said about the part of the volumes that we have, as well as the regulation, which is dependent on mainly the nervous regulation as well as the hormonal regulation. The part of the nervous and hormonal regulation is literally dependent on the types, on the special type of the substances, which are known as the adrenaline. I do believe you have heard about that. Yes, and in case of adrenaline, it does very interesting thing because the adrenaline or epinephrine, also known as epinephrine, um, it is literally giving us the bronchodilation. So as a result, the airways are opening in this case more, as well as here we do have the blood supply is also increasing, you know. And in case of the one of the cranial nerves that we have, we call it a vagus nerve or 10th cranial nerve. It is the one which is vice versa, giving us the bronchoconstriction. So what is interesting also is that when like what in the different conditions, I mean, except for resting condition, yes, we involuntarily, as a result, can have important effects. What is this? Like imagine when we are simply having, as I told you, exercising conditions, yes, what is happening that time? So we need to have more amount of oxygen. Yes, our tissues need more amount of the oxygen to produce more amount of energy. And as a result, involuntarily, it's not dependent on our own desire, we start to breathe faster. Am I right? So the breathing rate is increasing. This particular phenomena is known as hyperventilation. Hyperventilation. So increasing of the breathing rate. As a result, we do have more and more and more and more amount of the air which is passing per particular period of time, per minute in this case. Sure, we're talking about, okay? Um, for example, what we can find also, it's really very interesting that in case of the like you know the this involuntary type of regulation, just to talk about that portion, yes, you will say, okay, it's clear that okay, our body needs more amount of oxygen, but how do the lungs understand, and how do the whole respiratory system literally understands that it needs to hyperventilate? Yes, this everything is dependent on the increasing of the carbon dioxide in the blood. The levels of the carbon dioxide are increasing and the levels of oxygen are decreasing. You see? And as a result, we do have the special type of the receptors, which we call chemoreceptors. Okay, so these chemoreceptors means that they are recepting, so they are very sensitive to the chemicals, and these are the gases, oxygen and carbon dioxide. So it means that when we do have a larger amount of the carbon dioxide, for example, it means that we do have too small amount of the oxygen, and as a result, these chemoreceptors, which are not localized, they are not localized in the brain, guys. No, they're localized outside, so in the blood vessels, for example. Okay, they are starting to fire, so they are producing the impulse, and the impulse is traveling towards the brain, so the part of the CNS, central nervous system. And the central nervous system then, as the response, gives us more ventilation, gives us more opening of the blood vessels, so dilation of the blood vessels, and as a result, more amount of the more amount of the carbon dioxide is excreted, and more amount of the oxygen is vice versa passing towards the blood. You see? And here in this particular regulation, the part of the cranial nerves are very much important, the nerves which are coming from the brain. In this case itself, the chemical portion, so sensory portion, what particular nerve should be conducting this information. This is the type of ninth cranial nerve. We call it also glossopharyngeal. So it's like giving the impulse, okay? And as a result, the brain starts to try to get the, let's like that, a response on it. This is important to remember, okay? Also interesting thing that because of the presence of large amount of carbon dioxide, you know what is happening? Carbon, I told you, carbon dioxide when it passing towards the blood, okay? Here it starts to change the blood pH. You see? So the acidity of the blood is changing, which is also a part of the chemoreceptive mechanism. Okay? So, as a result, these chemical changes in the blood are giving the impulse to the nerves that, hey, there is a problem. And particularly, this is, for example, the part of glossopharyngeal nerve, which is then propagating the information where? Towards the brain. And we have adequate response. Is it clear what I'm saying? Guys, are you with me? So it's more or less clear, yeah? Okay, let's continue now. And here, when we talk about this, all of this normal type of the respirations, normal type of the airways, and so on, here comes the question: what type of pathologies we may have, what type of medical conditions we may have. And to be honest, in your textbook, we have the several of them, starting with one of the most common, which is the asthma. Have you heard about the asthma? As well as we do have the swelling of the pulmonary region, and that's what we call the pulmonary edema. As well as we do have the I don't know, inflammation of the path of the respiratory pathways. For example, it can be the bronchitis, so the respirate the simply the inflammation. In this case, it can be dependent most commonly on the infection, okay? As well as we do have one of the common genetic diseases. I don't know if you have heard about that. This is a cystic fibrosis. Well, the cystic fibrosis is really very interesting thing. To be honest, as I told you, it's the genetic disease. It's the inherited disease. And what is happening in this case? We have the problem of the fluid secretion. I told you that normally for normal let's like that cleansing of the airways, yes, and moisturizing of the airways, we do have the formation of the mucus. Am I right? So now the question is, this mucus, when it is produced, it simply means that there is the excretion of what? Or correctly say secretion of the fluids, yes? So in case of the cystic fibrosis, we do have a problem with these fluid secretions. It's abnormal, okay? And as a result, this mucus becomes so much, very, very viscous. It becomes very thick, all right? And what is happening? It's literally very, very difficult to do what? To make it move by the cilia. So cilia cannot simply move this mucus away. So to extract the oh my god, to get rid of the impurities. Okay, so as a result, what is happening? And the problem here is that because the mucus is not moving, so we don't have simply the evacuation of this mucus, but we have still the secretion of it. secretion of this very viscous, very thick type of the mucus. And as a result, the smaller airways, so the part of the bronchioles, for example, because of this increasing amount and collection of the fluid and this mucus in the lumen, they are simply blocked. So they are simply closed. You see? And as a result, we have a lack of a normal respiration. So besides of having the problem of the cleansing, from the other side, the buildup of that particular mucus is simply giving us the blockade of the respiratory airways. You see? You see the problem? Okay. So in this case, sure, this patients with a cystic fibrosis, because it's a genetic disease, it's really very, it's not curable, first of all. But we are treating here the symptoms. We are literally having the specialized type of the exercises. We call them physiotherapy exercises, and these exercises are helping to remove this mucosal layer. I mean, this excessive amount of the mucosal layer. So, and here, for example, the patients are asked to be they are coughing more, for example. There are some other drainage ways, and as a result, sure, it helps, but it's not the cure, unfortunately. And the lifespan of this type of patients is not that big, you know so it's like, and it needs a very good constant type of physiotherapy to prevent the closure of the smaller uh, airways, and to prevent the simply the lack of the air passage, and as a result, death, simply to say. Okay, because of the simply blockade of the airways. You see? We also have a very interesting clinical correlation, which we call asthma, simply. And here, if I remember correctly, we do have it in your textbook. Yes, as I told you, here we do have a part of asthma. So, what is asthma? Asthma is most commonly is the condition, let's say like that, when we do have the oversensitivity, let's say like that, of the airways to particular allergens, as you can see here, as well as to particular, for example, it can be also the exercise problem, the response to the exaggerated exercise, okay, or exposure to the cold weather, so cold climatic conditions, as you can see. And what is happening during because normally asthma is the chronic type of condition. It's not always acute. So as a result of when we do have the exposure to allergen or to exercise or to these cold climate conditions, in this case we do have this acute phase, which we call asthma attack. You see, asthma attack. And what is happening in this case? The problem is here that during the asthma attack, we do have the contraction of the smooth muscles in case of the bronchi, and that's what we call the bronchospasm. You see? And what will happen? We will have the bronchoconstriction. Bronchoconstriction means that we have the smaller diameter, so the bronchi becoming smaller in the diameter, and as a result, we again have the problem of the passage of the air. Okay, do you understand what I'm saying? And as a result, here we do have the, what do you see with your patient? I mean, what will be the manifestation? That's what we call dyspnea. Dyspnea simply means difficulty in breathing. Okay? Particularly, they have problem with the breathing out problem. That's what we call dyspnea. All right? Dyspnea is just the symptom. This symptom can be associated with the different types of the problems, cardiovascular, respiratory, but also for the asthma, that they cannot simply, they have a difficulty in breathing, particularly in the expiration, so to breathe out the air in this case. Okay, and they simply need a big forced effort to exhale. Okay, so to be honest, what can we do in this? Because if it's acute phase, so when a person has literally the dyspnea, when there is the bronchospasm, the only thing what we can do, we need to use the drugs which are helping in the emergency situation. Yes, so we need somehow to open the airways, so to relieve this bronchospasm. Okay, so as a result, any type of the drugs which are helping us to give the bronchodilation, they are used, and these are, for example, these inhalators. Yes, so the inhalators which are used during the this particular asthma attacks. So simply the acute phases of asthma. The problem here is that the asthma, because it's still a chronic condition, yes, you see, it's not just having like, okay, today I had the asthma attack and then everything is okay. No, it's not that. It's not like that. In this period, we do have a problem with the epithelium damage. Okay. And this epithelium damage sure gives us a worser and worser breathing habits, you see, and mechanisms. So as a result, we have a problem with the expiration. Okay, the problem here is that a larger amount of the air is trapped inside, and as a result, simply here we do have then during the inspiration less usable oxygen is passing towards the lungs, and as a result towards the body. Okay, you see. So this is a biggest problem in this case, in part of asthma. Is it understandable what I'm saying?
Yeah.
Well, what is also interesting, this is the part of the pulmonary edema. What is the pulmonary edema? I told you, swelling of the alveoli, of the regions of the respiratory system, and how this happens. Mainly, we're talking about the part of the lungs in this case. Uh, the buildup of the fluid in any place of our body means that there is no normal drainage of that fluid. Yes, so the blood vessels are not draining well this region. Am I right? So what does mean edema? What does mean swelling? Why should I have swelling somewhere? It means that where do I have the fluid normally? Yeah, sure, I have some small amount of fluid between the cells, that's for sure, but I still, how can I build it up? Like fluid is not coming out just like that from the cells, yes, because then the cell will shrink and die. So it should be coming from where? From the other compartments, and this is mainly the blood. Am I right? Because that's where we do have this part of the plasma which is circulating everywhere, and in some particular regions it can be simply building up. Am I right? So what is happening in this case? I mean, in this particular condition. You see, they tell you here about the heart failure. Okay, what does it mean, heart failure? First of all, when the heart is losing its main ability or decrease or the ability of the heart, which is only and only pumping. I told you heart is nothing, it's just the pump. Yes, which is simply pumping the blood towards the pulmonary circulation and towards the systemic circulation. Am I right? So in case of systemic circulation, imagine how big should be the left ventricle, and it's literally bigger than the right one, by the way. I mean, the muscle even is thicker here. Why? Because to push the blood towards the tissues, it needs to contract very forcefully, and if there is the problem of this forceful contraction, this means that we have the heart failure. Yes, particular stage, sure, I'm not saying that it completely is not contracting, so the patient is dying. No, but we're talking about particular stages of the heart failure. So, what is happening in this case? Hmm? If the heart, this left side of the heart, for example, yes, cannot normally contract. If it cannot normally contract, it means that it cannot push the whole blood away from the ventricle, yes, towards the tissues. Am I right? As a result, what is happening? I do have also always increased fluid, increased pressure in the left ventricle, so in the left side of the heart, and the blood which is passing from the lungs now cannot normally pass towards this region, towards the left side of the heart. Why? There is the pressure, there's a buildup of pressure. It's a problem. It cannot push it. Am I right? So it means that I do have the part of the blood which is in stasis, so it cannot move towards. Am I right? From the region of the lungs. So what is the problem now? What is happening in this case? I do have the passage of the fluid somewhere else. If it's not passing towards the left ventricle through the left side of the heart, so atrium and then ventricle through the blood vessels, so the capillaries will be leaking. Yes, will be leaking towards where? Towards the region of the lungs. And as a result, we have edema. So increased fluid in the region of the lungs. Is it clear? What is the problem? What is the problem? You say, okay, even if there is the fluid, then what? That's the problem. Prevention, as a result, we have the prevention of the normal gases exchange. So the gases are not exchanging normally. Gases are not exchanging, lack of the oxygen in all of the parts of the body will give you simply hypoxia, so lack of oxygen, and as a result, death of the tissue. So death of the patient. You see? Did you understand this part also? Yes, no? Yes. Okay, Maria is even using this exclamation mark. That's nice. Okay, so, and the last portion, what I want to talk now about, will be the part of the bronchitis. Yes, I told you that in case of any type of tissue, whatever it is, doesn't matter, we may have the inflammation of that tissue. Yes, and we do have the inflammation of the bronchis also. We have the two types of inflammation. One is acute inflammation and one is chronic inflammation. And as a result, you can see from here, we do have acute bronchitis as well as a chronic bronchitis. Okay? So, in case of acute bronchitis, what is happening? Most commonly, the bronchitis is the problem or it is caused by the viral infection. Okay? Most commonly. So, sure, there are also risk factors for it, and simple risk factors is one of the simplest. This is smoking. So any type, to be honest, of the diseases, whatever are associated, sure, not the genetic ones, but the ones which are acquired are most commonly exaggerated by the smoking habits. Okay? Well, what is happening here? In case of inflammation, we do have the swelling of this region because larger amount because the acute inflammation gives us the increase in the blood supply towards this region, so more leakage of the fluid from the capillaries. As a result, we have swelling. As a result, we have even congestion. Okay, as well as even we do have the formation of pus. Because if we are talking about, for example, the bacterial type of the infections, yes, the here we will have a large amount of pus formation. What is the problem now? So the lumen of the bronchi are decreasing in diameter. So I will have the dyspnea, as we've talked about, so difficulty of breathing again. Yes, doesn't matter. It will be from the spasm or it will be from the blockade of the bronchitis. There is still the lumen is the space is decreasing. Yes. So in both of the cases, I will have the dyspnea. Very interesting thing. We also have here the very interesting type of and both in asthma and the bronchitis, you can hear wheezing. You know what is wheezing? Like during respiration or during coughing, you can see this like whistling sounds. You know whistle? Yeah. So whistling sounds. And it's really, this is what we call wheezing. So this wheezing is very much associated with the decreased diameter, of the conductive airways. That's what is happening here. Sure, at the same time, what else can we have? We can have, sure, the high fever and so on. So all of these are the very simple type of the and very common type of the symptoms. Okay. In the chronic bronchitis, which is most commonly seen again in smokers, all right, or for example, also interesting thing that the chronic bronchitis is associated with how do we call it, the pollution, so like, I mean, the simply the atmospheric pollution. And what is happening, in this case? In this case, because the smoke or this pollutants doesn't matter, what they do, they are increasing, because like in case of smoking or in case of the pollutants, these everything are impurities. Yes. So as more impurities are in the air, our respiratory system tries to produce more and more of a mucus. And this mucus is literally now doing what? So this overproduction of the mucus cannot be that fastly excreted, and as a result, we again have like the blockade of the airways. Blockade of the airways, buildup of the pollutants, and as a result, we have not maybe very acute, but still we do have the inflammation here. Okay. As a result, chronic type of the irritation, chronic type of the condition is always having a tendency to convert into acute ones. Is it clear? So this part was more or less understandable.